Hi, my name is Florence Ajayi Barnes, your virtual family nurse practitioner, and welcome to the Flo-Medical Show, where you get advice and information you can trust. On the show, we discuss health, being an educated consumer, and you being your own best advocate. Disclaimer: this is valuable information, but please consult your healthcare provider. Today's discussion will be prediabetes and diabetes type 2. Prediabetes is when your blood sugar is elevated, but not high enough for it to be diagnosed as diabetes. 96 million adults in the United States have prediabetes. That's 1 in 3. 8 in 10 of them don't even know they have prediabetes. The good thing is that prediabetes is reversible through lifestyle changes and diet modification. Lifestyle changes is increase in physical activity and adding or increasing your exercise regimen. Diet modification is when we change things in our diet. And the primary things we would be changing in our diet would be carbohydrates, which are our starches. Breads, rice, potatoes, sugars, pastries, soft drinks, soda, all of those should be decreased. And if we decrease those and we increase our physical activity and exercise, we can reverse pre-diabetes. Now we have diabetes type 2. Diabetes type 2 is usually diagnosed in adults, but more and more we see children, young teens, and young adults being diagnosed with diabetes. Diabetes is when the body either doesn't make enough insulin or the insulin that's being produced is not doing what the body needs it to do. 37.3 million adults in the United States have diabetes. 1 in 5 of them don't know they have diabetes. Diabetes is the 7th leading cause of death. It is the primary reason of kidney failure, lower limb amputation, which is the removal of your legs, your feet, and your toes. Also, adult blindness. Over the last 20 years, the diagnosis of diabetes has doubled. When going to your healthcare provider, does diabetes should always be discussed. Now, what are the signs and symptoms? Usually, there are no signs and symptoms of prediabetes. But with diabetes, the signs and symptoms are increased urination, having to go to the bathroom throughout the day, even though you haven't consumed enough liquids. Increased thirst, even though you have drank water or whatever liquid that you have drank, you still feel thirsty. Increased hunger. You eat and eat, you're not satisfied, and you're still eating. Unintentional weight loss. You're eating food, but the weight cannot stay on. Numbness and tingling in your toes and in your hands. Fatigue, being tired. Also, delayed healing of any wounds or sores on your body. These are signs and symptoms that should be addressed. So please seek the guidance of your healthcare provider. What are the risk factors of diabetes? One of the risk factors are prediabetes. Like we discussed earlier, prediabetes is reversible. But if not treated or not corrected with diet and exercise, it can transfer over into being diabetes. Family history, being 45 years and older. Ethnicity, Blacks, Latinos, Asians, Native Americans are at higher risk of getting diabetes opposed to Caucasians. Being overweight, obesity, all of those are giving us the risk factors of diabetes. So how is diabetes diagnosed? Through a simple blood test. That's called the hemoglobin A1C. This test shows the level of glucose in your blood over a 3-month period. If you are not diabetic, that percentage should be below 5.7. If you are diabetic, the percentage should be 7 and below. If you're pricking your finger to check your blood glucose, the blood sugar, the normal reading should be 99 and below. So how many times a day should your blood sugar be checked? That's a determination between you and your healthcare provider, because your healthcare provider may want you to check your blood sugar one time or multiple times throughout the day for many reasons. It could be because you're taking multiple medications throughout the day. It could be because you're having signs and symptoms of the diabetes, or your diabetes is not controlled. But that is a determination between you and your healthcare provider. What gland in the body helps to control diabetes? It is our pancreas. The pancreas is a flat, pear-shaped gland that sits behind the stomach and produces insulin. Every time you eat, the insulin is being produced so we can lower the blood sugar. It is when that organ is not working like it should, we develop diabetes. Treatment options. What are the different treatment options for diabetes? There are 4 of them. Primary to most illnesses and disease, diet. We discussed diet modification earlier, which is decreasing your carbohydrates, your starches, breads, rice, potatoes, soft drinks, juices, sodas. Those are the things that you can modify or change to decrease your risk of diabetes. When we also have treatment options, it's oral hypoglycemics. Oral hypoglycemics are oral, by mouth, hypo, low, glycemic, sugar. So that means you're taking a pill by mouth to decrease the sugar. In the event that that's not affected, we can go to non-insulin injections. That means a non-insulin injection that does not have insulin, but it allows the body to produce its own insulin. That is either administered by your healthcare provider or yourself. If that's not effective, we can go to insulin. Insulin is given either by self-injection, meaning you giving it to yourself, or through an insulin pump. That means a pump attached to your body that releases insulin whenever the sugar levels are high. So it's altering the sugar levels with a machine that produces insulin. Most of these treatment options can be used in combination, but it's important that you constantly discuss this with your healthcare provider because you want to be compliant with your treatment options. What are the complications of diabetes? Heart attack, stroke, blindness, visual changes, all of these can be complications of diabetes. So as you go through your medical journey, do not let diabetes define you. Get informed and live your best life. There you have it. Now you have information that you can trust, know what to look out for, and treatment options. Please like, subscribe, and share this information with anyone you feel can benefit from it. My name is Florence Ajayi Barnes, your virtual family nurse practitioner, and I thank you for joining us at the Flo-Medical Show. See you next time.